Shelter insurance has covered a lot of miles and a lot of cars and drivers since 1946. We like knowing we have you covered, so you can just sit back and enjoy the ride. Shelter insurance. We're your shield. We're your shelter.
Ask Agent Mark Manning about Shelter's auto insurance discounts.
Peggy Pierce from White River Area Agency on Aging joins us this month, and we're going to talk about open enrollment, Medicare Part D. We talk about this every year, Miss Peggy, but this year there seems to be a lot of changes that we need to discuss.
Well, the format's going to be different this year. COVID-19 has changed everything. We talk about this every year, like you say. Everybody has an opportunity between October 15 and December 7th that they can look at the drug plans. Maybe their medicines have changed during the year, maybe the plans change in their premium or something. Whatever reason, they can look at the plans and they can make a change during that time if they want to. If they're happy with what they've got, they can stay, let it rock on. They don't have to do anything. But during this open enrollment, we have events in each of our counties where we have care managers set up with computers. The people come, bring their Medicare card, and they bring the medicines that they take on a regular basis, and we help them look up the options so they can decide which one is the best choice for them. Since COVID-19 has hit, things are a little different.
Okay.
We're not going to do the events where people come and sit in a room. We're going to eliminate that. So they will appoint a day in each county where the care manager will be available, but we're going to do it by appointment. If someone wants to look at the drugs, they need to call their care manager and make an appointment. That way we won't have people waiting in groups or we're going to eliminate as much personal contact as we can. When they come in, they will probably have to have their temperature checked, just like you did when you came in our office this morning. We will wear masks if we're dealing close. You know, you and I are 6 feet apart, but we'll be a little closer than that in looking this up, so they will have to wear masks. So we will still be assisting people, but the format will be different this year. And the 2 counties that are in your listening area, Jackson County, November 10th, Arlene has that day set aside. They can call their office and make an appointment in advance. They will be there between 9 and 12. They'll have that day just set aside to help people look at those plans.
That's in Newport.
And in Independence County, we're going to use the office over at 541 Barnett Drive, and they will be available between 9 and 1 that day. Again, people who want to be assisted with these choices need to call and make an appointment.
Peggy, let me ask you this. When you talk about they bring the drugs and might make some changes, a lot of times seniors may not really know what they need, and they need some expert help, and that's where you come into play to kind of give these folks this type of information that they need.
And everybody's situation's a little bit different. Everybody takes a different group of medications, and the way that you make a choice, you know, there's a www.medicare.gov website. If you're Medicare savvy, some people just do it themselves. They can get in there, and there's a place where you kind of have to set up an account now. That's a little different too. That started last year. But once you get into your account, you can enter the medications that you take on a regular basis. And one feature that's good on that site now, it saves the medication. Once you've looked that up, it will save that list for you so that if you go back in there, it should save your medications. But you can look that up and it will list all the different plans and what it will cost for your group of of medicine. So that way you can tell kind of what's the least cost for you. That's how you make a choice what's best for your situation, for what medicines you're taking.
Well, you mentioned choice, and there are some choices, and the thing about making those choices, sometimes people just really don't know, what to make, and that's why they need the help of somebody guiding them through, and that's what we do with these meetings.
And there are several choices because there are a lot of insurance companies that do sell the plan, so, there are a lot of choices to look at. And it pays every once in a while just to look at what's out there, because there could be something to save money on. And every drug plan does their own formulary.
Sure.
They have to cover drugs in each category, like blood pressure, diabetes, or whatever. So they somehow decide which tier they put that medication in. So that's why it's good to check every once in a while and see if you're getting the best cost. Like I say, if you're happy with what you got, if you think it's paying well and you don't want to do anything this year, then you don't have to make a choice or a change, but you can during that time if you wish to.
All right, tell us again the times when this is going to happen. When does open enrollment start? When does it end?
It starts October 15th, and it ends on December 7th.
Okay.
That's the time you can make a change.
And then in Newport, the date
Newport is November 10th between 9 a.m. and 12 noon.
Okay.
Independence County here in Batesville on November 17th between 9 a.m. and 1 p.m.
And of course, if you have any questions, you can call us here at the office and just ask about when these meetings are going to be. A little bit different because of COVID-19, but the world has really changed.
Everything is different right now. And, we still are seeing our clients through our in-home services. That nothing has stopped there unless the client says, I don't want anybody coming in my house.
Sure.
We've had a few of those, and that, of course, that's their choice right now. Everybody's being cautious, and certainly that age group are the ones that you do want to protect the most, because you sure don't want to expose them to anything. But we are seeing our clients, the home care assistants are still going in and doing the care. We're masked up, and we're taking all the precautions, but hey, it's just a different world right now.
Well, it is, and it's just like, you go to White River Area Agency on Aging, and we're not here today, or we're not here. You have to make an appointment to get in, and as you mentioned earlier in the show, check the temperature to make sure we're okay. Have to social distance. There's just guidelines that we have to follow, because those are the guidelines that we're supposed to do to try to make everybody healthy.
Yes,
so good to see you, girl.
Thank you.
So
we just
good
want
to
everybody
see
to
you.
be safe, and but we can still assist you. We'll just do it a little differently now.
That's what White River Area Agency on Aging has done. They take care of seniors, and we continue to do so.
Flexibility.
Absolutely. Thank you, ma'am. We appreciate you, Miss Peggy.
Thank you.
M&P Insurance with Caroline Beecham, and once a year we get to visit with her, and we get to talk about Medicare and what's new and things that are happening in the Medicare world. But good to see you again. Welcome back to the program.
Thank you. I appreciate it.
We talk about this time of year because we have the enrollment period coming up. First of all, let's get right at that. We have some other issues that we want to kind of go over also.
Okay. Beginning October the 15th through December the 7th, that is when the enrollment period is, which means that you can make any changes that you want to your Medicare prescription card or Medicare Advantage plans. And those plans, those changes will go into effect January 1 of 2021.
Tell me exactly what that means in layman's terms for somebody that may not know about it, or somebody that's new to the Medicare. What exactly does that mean? What are we supposed to try to do?
Well, every year your plan, your prescription plan, or your Medicare Advantage plan will change January 1.
Okay.
So you may have had some changes during the year. You may have different prescriptions. You may see different doctors. You may have some changes. So this enrollment period allows you to review your current plans compared to the plans for the coming year and make any changes that will fit you.
I know when you start talking about changes, and we at our age, we sometimes get overwhelmed with the amount of changes that we might have to do, and we might get frustrated with those changes and go, I'm just not going to do anything, and that might not be the right thing to do.
Exactly. I've had several phone calls recently from people saying that there are so many choices, there are so many different options, that they're overwhelmed, they're frustrated, they don't know what to do. And I totally understand that. And my recommendation to those people is to talk with a professional who is qualified to represent several different companies so they can help you wade through all those options.
Well, when there's a lot of options there, and we just look at them and we go, golly gee, I don't know what to do. Let me just sign it, send it in, and then all of a sudden it's costing you more money than what it should be able to cost you. Yeah. We had talked about, before we got on the air, we talked about state employees and retired state employees, Medicare employees. A big change there, and it's a huge change that they need to be aware of if they're not already.
Yes, state employees should have received a letter letting them know that beginning January 1, 2021, they're going to have to find prescription coverage. Their current plan covers prescription coverage, but it will not effective January 1. So what are those people, what do they do, where do they go? Here again, to find a certified professional insurance agent who represents a lot of different companies who can help them wade through what their options are, because most of those people don't have any idea because they've always been on their current plan, and that is a big change for them, and we need to be there to help them.
Well, that's what you do. I mean, that's your job for M&P Insurance, and you've been doing it for quite a while, and you have a lot. I mean, obviously that gives you a lot of experience and it's an ever-changing world, and you need somebody that's up to date on everything, all the changes that are there, and that's exactly what you do. And I mean, changes overall in insurance, they're out there. All the changes are.
Yes.
Then when it comes to our age people, these people that are Medicare related, tremendous change for them and just lots of thought process. They need some professional help, and that's what you provide.
Well, thank you. And I try to. The one thing that most people will end up doing is they don't know what to do. They stay with what they've got, and they end up paying more than they need to. And that's why I encourage people to reach out and talk to somebody who can help them.
You had mentioned earlier also about writing an article in the Eye On magazine, and I mean, it's good that you can get out in print form, and had a call this morning, you said, from someone that read the article and needed some information. But for those of us who need more information and how to get in touch with you, what do we do?
You can call me. I welcome you to call me. My number is 501-868-6650, and that's my direct number. And if you've got questions, if there's anything that I can help you with, I'm more than happy to do so.
Caroline, it's always my pleasure to get to come down and visit with you and joke with you before we get on the air, and then get to do what we do that you do quite well. So thank you so very, very much for joining us.
Thank you. I appreciate it.
Welcome, John Chadwell, again to Cable 15 TV and Facebook. And a huge announcement that we have this morning. We're filming on a Tuesday morning, and this is on the heels of our last week's interview when we talked about the Tech Depot as such. And we have some news regarding the Tech Depot and what's going to happen in Newport, Arkansas. How are you, my friend?
I'm doing well. How are you doing?
Absolutely real well, and excited about this announcement that we're fixing to make right here on Facebook.
Yeah, the Tech Depot, you covered about 3 weeks ago, the ribbon cutting. We had the governor and other dignitaries in town, and it's going to be a big project for us. At the same time we were getting the Tech Depot started, we applied for a grant from the Economic Development Administration, and we found out that they have awarded us $2.5 million to build a center for Tech Depot. So we're going to have a state-of-the-art training center for Tech Depot, and we are really, really excited about it. A press release will be going out today, but you're getting the scoop. It's the David Black scoop, and you're going to scoop everybody on the story. But the congressional delegation is very excited. They helped us get this grant. White River Planning and Development wrote it for us, but we're pretty excited. There'll be a $3 million building being built in downtown Newport that'll house the Tech Depot, and hopefully within 5 years we'll have about 100 students going through it every 6 months.
Well, John, I mean, anytime you make an announcement of this magnitude, it's huge. I mean, the announcement of getting the Tech Depot and having these people come in and do their training here, that's a big announcement. That this is a huge announcement of the money that's going to be invested in our community, because that means a lot of people above us down the road in the government as such believe in what we're doing here in Newport, Arkansas, and those folks have entrusted us into doing a great job for this particular project.
Yeah, they looked at our plan and what we have on paper for what the Tech Depot is doing and what it's going to do, and they believed in it. And I mean, a $2.5 million grant is huge. We have to match it with $625,000, which the NEDC is going to put in. So it'll be a $3.1 million project. It's going to be a good construction project during that phase. But then the people who go to school in this facility will also already have jobs, and so they'll be working while they're going to school. So it's just a win all the way around for us, and it's going to give us some opportunities to recruit tech companies to our area.
I know that it's early in the project, but do you have any idea on time frame of starting and when we're going to get going on this thing?
Engineering and architectural work will start right away. We'll be working on that. We've got some renderings which we'll be sending out, but it may change a little bit. That'll start right away, and construction will probably start, I would think, by the spring.
John, be the first people to put this on the air, and just congratulations to you, the city of Newport, Jackson County, the state of Arkansas, and everybody else that's great things are happening in Newport, Arkansas, and this is another one of the big ones.
It is, and we really appreciate you being one of the folks who helps get the word out, and always a big supporter and booster of everything. So this is a big win for everybody.
John Chadwell, NEDC, Newport, Arkansas. Thank you, my friend, and congratulations again.
Thank you. We'll talk soon.
Customized Vision Care in the Newport Village Mall, visiting with my good friend Dr. Gavin McDowell, and as always, sir, my pleasure.
Oh no, the pleasure is 100% mine.
And we've talked about this for years, and we're going to talk about it again, and someday we're going to record what we need to record, the pre-show, because the pre-show always ends up being more interesting than the real show. So we need to make a real show. Let's do the same thing what we talked about.
But the problem is the pre-show, half of it isn't airable.
That's correct.
And it's not that it's lewd humor. It's just
not airable.
Yeah, it's just not airable. Yeah.
Which could mean a lot of things.
But it's not like we've got the sensors breathing down our neck.
No. We could go ahead and put on what we wanted to, but on Facebook they would probably just kick us right off and never allow me to be back on Facebook again. And so therefore we wouldn't get to talk to our friendly folks out there in Facebook land that love watching our show. And we thank you for all the cards, the letters, and everything.
And I've got plenty of chocolates, so
no need to send
tone that down a bit.
Please quit.
Cash donations will be fine.
We do accept cash.
Yes.
So how's Dr. Gavin McDowell?
I'm good. I'm well, thank you.
And the business people are getting their eyes checked at a pace that they need to, and we totally recommend people to do that.
Absolutely.
Business been brisk?
Has been brisk. We're getting to a little bit of a fall lull, which it always does. It's this time of year, school's gotten back in session, and everybody's thinking about, Halloween and getting prepped for Thanksgiving and hunt season. But when hunting season starts, we kind of pick up because most most of the hunters realize maybe I'm not that bad of a shot, and so they
Really?
Yeah.
So they can come get their eyes checked.
It's a reminder that they can't see as well as they think they can.
Well, I think obviously all of us, the older we get, the more often we need to get it checked. We talk about that a lot also, but I've never thought about a hunter.
Yeah.
I mean, he's trying to scope that thing in from away. Yeah.
I'd tell you that one of the more difficult patients who come in here are the bow hunters.
Right.
Because it's usually, and not all the time, but it's usually older men, and when I say older men who are now in the need of using reading glasses.
There you go.
On a regular occasion.
There you go. I like that.
The problem is they're shooting a target that's, yards, dozens or even hundreds of yards out with a bow that has a peep that's right here and a sight that's right here. So it's all about trying to figure out what is going to work for them to see all three of those things and get it lined in right for them. I've actually asked a patient to bring their bow in one time to measure a few things out.
So how does that work? I mean, what's the answer to that when a guy comes in and says, how do I do that? What in the world from a doctor's standpoint and an optometrist standpoint say, well, here's what I think we need to do to get you to see through all.
You want the long answer or the short answer?
All right, whatever. I've got all day.
The short answer is I'll tell you when I figure it out.
That's what I thought.
Now the long answer is basically you need a multifocal lens, a lens that will do everything you want it to do.
Okay.
Preferably in a contact lens form, which don't work very well for most patients. But I've found a lot of success with my hunters, especially bow hunters, with using a multifocal contact lens, even if that's the only time they use it. I've got a couple of gentlemen who wear glasses, have a what's called a flat top bifocal. That's a bifocal, has a line in it. Had no consideration whatsoever about wearing a contact lens or anything like that. And I'll fit them for one eye with a multifocal.
Yeah.
It ain't anything that they're going to want to wear all the time. They are not going to be happy all the time with that kind of vision, but it works well for what they want it to work for. It's a tool. It's a particular tool you get for it to do a particular job.
You are kidding me.
No, I'm smarter than I look is what it is.
No, that's amazing
Yeah.
to me. It's amazing that a hunter, and I'd never thought about that, but that's exactly what they have to do. They do have to look through a little small little hole to that and then something down there, and they come in and say, help me hunt.
Yes,
Help me
yeah,
hunt.
yeah.
And is there any extra charge for that?
No, actually not. It's all same old. Even if you come in Joe Blow who just want to see the TV scores better or, do anything you want to. It's going to be the same thing.
When gentlemen at my age,
You're stretching the word gentleman a little bit.
well, okay, those people that are my age,
Okay.
that might come in that have never worn glasses before, which would be unusual. That would be unusual.
It's not uncommon, though.
But when they come in, what is their generalized? Generally, what do they need? I know they want to see, but what are their complaints?
I don't see like I used to. I kid you not. I've at least once a month, maybe once every 2 months. I may be exaggerating that a little bit. But anyway, I'll have someone who comes in who's in their early 50s, ask them, when was your last eye exam? Oh, this is my first one ever. Oh, well, you're in for a treat today, my friend.
Really?
Yeah, and it's really funny because if you're farsighted, meaning you see things at a distance fairly well without any glasses, if you're just that right sweet spot farsighted, you won't need glasses ever until you get in your 40s and start having to use your reading glasses.
Right.
And at that point, you start having to push things further out and like, oh, I just don't, something's wrong. Something's wrong with my eyes. I must have the Mongolian bangalang or something.
Yes,
I can't just be that I'm getting old. But that is realistically is a natural process in the eye that affects everybody. But farsighted patients have the ability to go most of their lives and see off at a distance clearly. And then when they start having problems up here, a lot of times it'll start taking some of that vision out there too. And so I've had patients who, like I say, come in their early to mid-50s, never worn glasses before, never had an eye exam. And the next thing you know, they're walking out of here with a prescription to wear glasses all the time.
That's amazing to me. Yeah. And I guess we as gentlemen, or I guess ladies too, could just, you probably fight that urge to say, I know it's not as good as what it used to be, but that's because of my age, but this is probably normal for everybody and nothing could fix that until they get here and find out, golly gee, I should have come years ago.
Yeah, oh yeah. And then you have that one side of the coin. On the other side of the coin are the people who come in and their eyes just dumpster fire in the middle of a train wreck, and I could strap the Hubble Space Telescope to their head and they still wouldn't see right. They expect to get fitted for a pair of glasses today.
Right.
I want to see today.
They didn't worry about last week, but today's today.
The last 40 years, whenever I haven't taken care of anything in my life, I want you to fix it all today. That doesn't happen.
And your answer is always what?
My answer is it's my goal to try to get you to as good as I can get you. Now that may not be, it may not be to fit your expectations, but I will get it to where I can get you.
Well, you look in mine and you mentioned the train. You always say you don't want to see this train wreck, and you're not the only one that's ever said the left eye's a train wreck.
Yeah.
And sometimes you just get train wrecks, and sometimes you just didn't do what you're supposed to do.
As one of my favorite sayings, every day it sucks to be somebody.
That's exactly right. Exactly right. So everything's going well, and we've conquered the world. We've got all the we've got all the hunters where they can see, and school children. We talk about school children all the time, and they need to get in, especially if you've learned and you've had enough time right now that they've been in school to where you might tell something is wrong when they're not doing as well as what they normally would do in school.
Exactly, and it's not just how they're performing, but are they complaining of headaches? Are they squinting when they're reading their books or whatnot? If they're complaining of headaches and you notice them squinting, don't just don't look at this child and say, oh, they're so young, there can't be anything wrong with them. They might just need a little bit of help. And you won't know it until we measure it up, because the screenings that they do at the schools are fantastic. They have a fantastic purpose. They catch those children who would not be caught otherwise. They have drastic problems. If they're not trying to find those fine details, it can be helped with a simple set of reading glasses. It can change a child's perspective on learning for the rest of their lives. If you catch that early, it can change their lives immensely.
Well, that's what we do here at Customized Vision Care in Newport, Arkansas. We invite you to give us a call at 870-523, and the rest of them are 333-3333.
I think there's 4 of them.
4 threes.
I think so.
That would be 12, 4 times 3 is 12, but it's all 33333.
It is.
But we certainly ask you to consider us when you need services that we provide, and sunglasses.
Or services I don't provide.
That's correct.
Why not?
If you need something,
I can probably change your oil.
Just if you need something from us, whether it has to do anything with optometry or not, you let us know, because we'll try to take care of you. My friend, Dr. Gavin McDowell, as always, my pleasure, sir.
No, mine.
Hello everyone, and welcome to the October edition of the Farmers Supply Association Agriculture Report. I'm Randy Klepechka, agronomist with Farmers Supply Association. Well, I want to give you a harvest update this month. You remember last month in September, harvest had started, but when I started my program, I said, well, harvest has started, but it hasn't been the start we wanted, because at that time we just had Hurricane Laura come through, and a lot of rain, anywhere from 5 to 10 to 11 inches of rain, a lot of wind. Luckily, not as much wind as we had feared, but we still had quite a bit of wind, and everybody was worried about harvest being off to a bad start. Well, things have changed a whole lot since that time, and now we're in October. We're taping on October the 9th, and things are looking a lot better. We had a really good month over the last month to get harvesting done. Really, 1 3-day window, September 22nd through 24th, we had quite a bit of rain come through, but before that and after that, a lot of good harvest weather. So, we're moving along very well right now. Just like to update everyone by crop on what's going on with harvest. First, rice harvest. We're about 80% done on rice harvest right now, so we're making good progress on that. Looking at yields, they're really variable across the board, and later in the program I'll talk about some reasons why I think they are across the board, and maybe some things we can do in the future to maybe even that out and avoid some of the up and downness that we've seen this year. Corn, we're in a cornfield right now near Tuckerman, and so corn harvest is still going on. There's a lot of corn been harvested, but still quite a bit in the field to go. So, but the corn yields have been good. Not necessarily a lot of just bin busting yields, but very good yields, and I think it's a very good corn crop. And again, we're still harvesting that. Soybeans, and of course soybean progress is a whole lot more variable. We've got guys that haven't even thought about harvesting soybeans yet, still working on corn and rice, so haven't even thought about soybeans, and a lot of their soybeans are still green. But on the other side, we've got some guys that are done with soybean harvest already. They're done with everything, completed harvest, so that's kind of what we're seeing with soybeans. Good yields is what I've heard so far, and a lot of the yields I've heard have been with people that are entering growing beans for the soybean yield contest, the Arkansas soybean yield contest. So we're seeing some really good yields with these. Of course, we're seeing some guys that are putting a few extra inputs a lot of times into these and putting them on their best ground. But with that being said, I've heard some yields in the 70s, 80s, and even 90s in some of these contest fields. So I think we've got a good crop out there. Overall the crop won't be that good, but it's still a good crop, I think. Again, I mentioned with rice, what we're seeing with rice is just a lot of variability. Usually after about 10-20% of the rice crop is harvested, I've really got a good idea of it, whether it's an average crop, above average crop, below average crop. But this year it's really been across the board. A lot of good yields, but then we just drop off in certain fields and have some really disappointing yields. So that's kind of what I want to talk about right now. We're seeing these disappointing yields in certain fields. Now we've got a lot of good rice out there. It's still a good rice crop, but again, the erratic nature of these yields are something that we're seeing a lot of and hearing a lot this year. So just want to talk about maybe some of the reasons we're seeing that, some of the things we can do in the future maybe to help kind of even that out a little bit and not have quite the up and downs that we're seeing this year. I think there's some things that we can do management-wise to help with this. Of course, the first thing we think about a lot of times when we have these erratic yields, and it's probably one of the main causes of it, is certain weather conditions. And there's not a thing in the world we can do about the weather, obviously. So, we can't do anything about that. We're just going to have to work around that. But that is the cause of some of it. A couple of things going on there. When rice is pollinating, we don't want big thunderstorms to come through, and occasionally we probably had a few of those this year. It wasn't a lot of those, but I think we had some thunderstorms here and there with heavy rain and wind during pollination that probably affected grain field and pollination, and have hurt yields in some of those fields. Also, hot temperatures at the wrong time, hot temperatures during that pollination period all the way through grain field can affect things. We didn't have a lot of hot weather this year, but we had some periods now and then that may have affected yields. So again, weather is something that we saw that probably caused some of this erratic nature, and again, not a thing we can do about that. But there are a few management things that we can do to probably alleviate some of this erratic nature of it, and I just want to talk about a few of those. One is varieties. And typically every year I always say that that it seems like the most consistent varieties are those hybrids and also the medium grains. And to an extent that is the case again this year, but I've heard some hybrid yields that have been kind of disappointing in comparison to to what we normally see, and also some Jupiter yields that have been a little disappointing. So again, I think the hybrids and the medium grains are still more consistent, but they haven't been totally consistent this year. So that's where we need to be leaning for, I think, as far as consistency, or those varieties or the hybrids and the medium grains, but that's not the answer to everything. And again, this is not to talk bad about any of the clear fields or the the conventional varieties. They have great yield potential as well. It just seems like they're not quite as consistent, and that's the case again this year. And so again, variety wise, I think as far as consistency, the hybrids and the medium grains, but again, don't forget these other varieties, because they can really perform well as well. Planting dates, we always say the early planting dates are where we need to be, and that's generally the case. I think we avoid some risk with the early planting dates, but that's not the total answer to everything, as well. This year, looking at the planting date study down at Stuttgart, the March 27th rice cut very good. The April 21st rice cut very good. In between there, around April 6th, the yields dropped off quite a bit. So it must have been a weather event during pollination and grain field that caused those to drop off. So that's a concern right there. So again, I think early planting dates eliminate some of that risk, but they're not the total answer. But again, I think we need to be leaning towards early planting always. Potash fertilizer. I think potash fertilizer is very, very important for our farmers. It helps with disease resistance. It just seems like it helps with yield, so I think we've got to make sure we've got those potash levels up high. You know, a lot of times we've got guys maybe going 60 units out there in their pre-plant potash, and I think most of the time we need at least 90 out there. I mean, we need a soil sample to see where you're at, but make sure you've got adequate potash out there, or I think your yields will suffer. And some varieties seem to be more, troublesome with that than others. So keep those potash, rates up there high, keep your levels in the soil high, and I think that'll help you overcome some of this erratic nature of the yields. Also, early nitrogen can be a factor as well. Some of these varieties that we grow, the early nitrogen is really critical that it be timely, and sometimes we miss out on that timing. So we've got to make sure that we have that early nitrogen time well. I think, I harp on this every year. I think guys need to be running the DD50. It'll tell you when the last date to get that nitrogen out there early and get it incorporated with the flood before that those yields start dropping off. And once those yields start dropping off, that drop is pretty steep. So we need to make sure we've got our nitrogen out there in a timely manner. Run you a DD50. I mean, it's on the phone now. It's easy to do. We're doing a lot of other things on our phones that are a lot less, useful than that. So I think if guys would be running their DD50s, just, again, you can run that on your phone, have it right there with you. That way you know when that date you need to have that nitrogen incorporated by. And again, certain varieties are more sensitive than others, but I think it's very critical that we know that date and we have that, not only have that fertilizer out there, but incorporated by floodwater. And I think if we do that, that's going to eliminate a little inconsistency there. Also, fungicides. Most of our guys are using fungicides right now, but we're seeing some little nibbling diseases like narrow brown leaf spot that I think are affecting yields. The smuts, fall smut doesn't affect yield that much, but kernel smut does. So I think we need to make sure we get some fungicides out there on most of these varieties, and again, if you're not wanting to spend a lot of money on fungicides, sometimes just that propiconazole or generic tilt application is all you need out there to overcome some of these other diseases. So let's be trying to get a fungicide out there during that boot stage, and I think that'll help you overcome a little bit of this erratic nature of the yield. So, again, that's where we're at, making good progress with harvest in our area right now, and the yield's mostly good. Again, a little bit of an erratic nature in some things, but yield's mostly good, and hopefully we can get this thing wrapped up. We got another hurricane coming in as we tape on October 9th, and hopefully it's just going to skim us and not give us a lot of damage. But anyway, hopefully we can get this crop knocked out in October and be ready for a good winter. So until next time, this has been Randy Kopechka with your Farmer Supply Association Agri Report for October.
Health Harris Medical Center in Newport, Arkansas. This is Shawna Worthington who joins us. And Shawna, we want to welcome you to the program.
Thank you. Thank you very much.
Now, everybody knows Shawna Worthington, but for those people who don't know Shawna Worthington, tell us a little bit about you, tell us a little bit about your family, and tell us a little bit about how long you've been here at Unity.
Okay, well, I've been here all my life. I went to high school here in Newport and started working at Unity. At the time, it was CHS Hospital, Harris Medical Center, but I started working here about 18 years ago.
Wow.
So just right when I got in the radiology program, I got a job here and been here ever since. So I love it here.
Yeah, every time I'm in this hospital, I see you. And I wanted to ask you this because I've never asked you before. Why radiology for your field, and when along the way did you decide that's what you wanted to do?
Well, I knew I wanted to do something in the medical field. My mom was always sick when I was younger, so I stayed in the hospital, and the nurses always was so good to her and gave back, and so it was something I just always wanted to do. It's really a big deal when you're in the hospital and you have a sick family member and you get good care and, just smiling faces, and I just knew I always wanted to do that. And I chose radiology because nursing, I kind of looked into that. I kind of like to do something different. In radiology, you can do several different things. And so not only do I do the mammograms, I do MRIs, I do CTs, I do x-rays. So I can kind of do everything. So it never gets boring.
And you mentioned those things because when people talk about radiology, they really don't think about the CTs, and they really don't think about the MRIs. And you think radiology, we're going to put something in your stomach and look at it, blah, blah, blah. But you guys have a wealth of things that you do for the general public, and we want people to know that mammograms. This is the month that we set aside for that as such, when every month is set aside for it. But talk a little bit about the mammograms, and let's talk a little bit about the CDC guidelines that we have in place here at Unity Health Harris Medical Center, because we folks want you to, in Breast Cancer Awareness Month, come get your mammograms done.
Yes, that's exactly right. You know, we slowed down when COVID first started, you know, and the mammogram is something as a screening. If you're not having problems, it's something you can do later, but definitely we're picking back up. We're doing lots of precautions, lots of extra cleaning, and so we've really picked back up. Everybody's coming and getting their mammograms now, because it is really important to get your screening mammogram.
One of the things that you and I had talked about prior to the interview, that we have a doctor, Dr. White, that comes in and talk a little bit about him and what he provides for Unity Health now that we haven't had in the past.
Well, he's coming in, so when you have a problem and we're doing diagnostic mammograms and breast ultrasounds, you have to have a radiologist right here, and he's able to come down from Searcy. He works with the RAPA group, and he is going to be able to offer some biopsies same day. If he thinks that, you know, a spot is suspicious, he's going to go right then and do a biopsy, and so you don't have to reschedule and go somewhere else, and we've never had that before, so we're really excited about that.
Well, it's just new things that we're adding at Unity Health right here in Newport, Arkansas at the Harris Medical Center, and I know you've worked for a lot of years, as you mentioned, in the radiology department and taking care of folks, and that's what we do at Unity Health Harris Medical Center.
Yes, sir.
Shauna, thank you so much for joining us, and we again encourage people to get those mammograms. And if you want a mammogram, how do we schedule those appointments?
Well, actually, mammogram is something that you don't have to have a doctor's order, so you can just call our scheduling department at 870-512-3042 is our scheduling, and you can just do a self-requested mammogram order. And I do want to mention a couple of things about the screening mammogram. When you come every year, it's like a 99% 5-year diagnosis rate. If you were to develop breast cancer, your survival rate goes up. It's like 99% of having your regular screening mammogram every year. So it's very important to come every year because you can catch something so much faster. By the time you actually feel something, if you're just doing self-requesting, mammograms, and 8 to 10 years faster almost before you can feel something. So it's very important to get your screening mammogram.
Get those done right here at that phone number, and we certainly thank you for taking time to join us. It's Shawna Worthington from Unity Health Harris Medical Center in the radiology department. Thanks for joining us.
Thanks.
Well, welcome to another edition of the St. Michael's Report with my good friend Jay Cox, the crappie man, the guy who brings all the big slab crappie in the boat. Welcome back, my friend. How's Jay Cox?
I'm doing well. How are you?
I'm absolutely well, and haven't been fishing. I got to ask you about the fishing report first. Have you been bringing those slabs in?
You know what? No, I've had to do a lot of work, so it's been not been doing much fishing, and I've had a little trolling motor problems on the boat, so it's been parked, but I finally got me a trolling motor, so just got to get it mounted and ready to go.
Well, you should have just gotten the paddle. I mean, use the paddle.
I ain't paddling that boat.
That paddling's tough, isn't it?
It is.
That's paddling tough.
But, it's part of it.
There you go. But I know you guys have been busy at St. Michael's Place and quality care, and let's talk a little bit about what's going on out there. And you said the governor has maybe gotten some good information that we can pass along to the public.
Yeah, I believe most people that are paying attention to the governor and the directives set forth by the state of Arkansas, we are in process of getting to allow visitors to come back, and I know the residents are getting excited about that. It is a little bit of a lengthy process, but we are in the middle of our weekly testing for the coronavirus, and after a certain amount of days and a certain amount of testing, as long as there are no positive tests after a certain amount of time, then we will be able to allow certain types of visits, either outside or a designated area that we supervise, And so it's not just going to be open the doors, coming in and out at all hours of the day and night, but there will be designated visitations, and so it's coming. It's coming. It's been a long time coming, and our residents are so ready to see their families, and I know families feel the same way. But at least we're seeing the light at the end of the tunnel, and so we're excited about that. It's been tough. It's been tough on the residents. It's been tough on the staff, and we're exhausted. It's been changes. It's been. This is a thing we've never seen before, at least in my lifetime, and these are things that we've had to make adjustments and
daily adjustments.
And the thing is, this is a virus that a lot of the scientists even still don't know a lot about, and they're still working on vaccines and solutions, and 1 minute you have to do this, and the next minute you have to do that, and the regulations change, and so we're doing the best we can.
Jay, I don't know of any other business that has been affected as much as what your business is, the nursing home industry, simply because if you're in a nursing home, the one thing you need is you need good quality care, and then you need a strong family support system from those people. And then when the family can't be there, I mean that's a heck of an obstacle to overcome in the everyday changing of what you guys have to do in your job. It's difficult. I can see where it's been difficult, and you guys can tend to handle it well.
It is difficult, and one of the things that to the public, they don't want large gatherings, and they don't want people to be confined in small places. But then you get a home where it is a large gathering, and so we're having to social distance within a large gathering, and then with some of our residents, whether it's age or memory loss or their disease process, they don't understand, and or they may forget. One day they understand, the next day they don't, and so it's a continuous process of either reminding them or just simply trying to keep that social distancing, and then the wearing of masks, and then the sanitizing from the rooms to the larger areas, clothing, the items in the room. It goes from what was already a difficult job at times to an even more difficult, trying to do the extra sanitization and the extra cleaning, and it's just been a complete change in our environment. And with that being said, there are times that we sometimes miss it. We're not in a perfect world, and when you're dealing with people, and plus with all the added sicknesses, and with all the added regulation, let's just be honest. There's no perfect facility, and St. Michael's, when we do miss the mark, the one thing about it is we have an excellent staff. We have local people. We have some staff that drive in, but we have a caring staff that I believe is there because of our heart. You got to have a heart for long-term care, and a heart for people, and a heart for these elders. And when we do drop the ball, we get right on it, and we do our best to try to fix it. I wish we could say that we please everybody in every single situation, but I'd be lying if I said that that every situation that comes up that we've hit the high point. But whether it's a hospital situation or a nursing home or assisted living, there's sometimes, especially with these new added pressures, that everything always falls into place exactly like you like it. But you know what? The good thing about having a good staff and good people is that we jump right on it, and we fix it, and we do our best to rectify every situation. And at St. Michael's, we've had to overcome many challenges in the past, and I believe right now that we are the best facility in our area, and I'm excited with the staff that we had. Over the past few years of interviews, we talked about how we've had to build staff, and bring in people, and I think right now we have some of the best.
Well, the people are good, and the quality is, absolutely great. We talk about that all the time, and it's what you should expect from St. Michael's Place and Pecan Street in Newport. And I know that since you've been there, and we've been doing these interviews just like you mentioned, we talk about the good things that's going on out there. And but we see the challenges too. I think the general public sees the challenges. I see the challenges that and the pressures that you guys are under, but there's no doubt, and I really miss getting to go in as an interviewer and from a business. I miss getting to go into the facility and saying hi to those folks that I know, and I can imagine what it does to people who have loved ones out there. It's just it's tough on everybody, isn't it?
It is, and the staff, they get tired,
right?
With the added, even the gowns and the mask and the face shields, all that, let's just put that into perspective. The temperature is a lot hotter.
Sure.
When you have to wear all that stuff, sometimes the staff has to go out and just take a breath and cool off. When you put on all the extra protection, to protect us and protect the residents, there's regulations about, especially this time of year. It's been. I went to work one day this morning or this week, and it was like 40-something degrees in the morning, and it'd be like 70 in the afternoon. Well, there's regulation in long-term care about you have to keep those room temperatures at a certain degree. And so with our building, you can't just, flip the air on and the heat on. It's not that easy. It all has to heat up and cool down. And so, with all that protective gear on, our staff can get winded, get hot, get cool, and so, but we have to maintain certain temperature for the residents. And of course, the resident comes first. And so, used to without all that protective gear on, it was a lot easier for the staff to do their job. Now, with all that extra stuff on, it makes it, sometimes it takes longer, and because of certain regulation now with having to take on the robes and all that stuff, or the gowns, and then take it off and go and do the extra sanitizing, the extra washing, and so. Where you used to be able to go from room to room a lot faster, now you might take an extra 5 or 10 minutes to go here and go there and do. And so, people have to be patient with us, and then we have to have, extra staff to be able to handle what used to be, I will say an easier job, or a job that ran much smoother. Now it's a little more difficult. And so, that's one of the things that maybe the outside community don't understand, that we're seeing it firsthand, and the staff does get tired, and speaking of that, we are needing staff. So if you're a CNA, if you're a nurse looking for a job, come by and fill out an application. We need staff. So.
Well, I do know this, that the great news from the governor. I mean, when you talk about you're on a path, you have a plan to try to get to open up, and you talk about being in the middle of the plan, you got to meet a lot of you got to meet the criteria to get to open up, and St. Michael's well on their way to doing that, and the folks in Newport, Arkansas will be appreciative when that gets done, my friend.
That's right, and we've been very fortunate to be able to keep those viruses out of our facility. We've been very diligent to maintain good health in our staff, in our residents, and we're just looking forward to the future, getting to be able to open our doors and allow family to come back. So. To the community, thank you for supporting us and being a part of allowing your loved ones to come and be with us throughout the years. And we're local, we're strong, we're not going anywhere, and we thank you for supporting us.
Jay Cox from St. Michael's Place, the crappie man extraordinaire.
Now deer season.
And deer season is upon us. Thank you, my friend.
Yes, sir.
Well, it's the Greyhound Report, the First Community Bank here in Newport. Greyhound Report. Get to visit with Mr. Brett Bunch from time to time, and somebody over at the Newport Special School District. Good to see you again, sir.
Good to see you. Everyone's healthy and wealthy and wise.
I like that. I like that. Well, we talked a little bit before we got on the air, and we talked about some of the challenges that we've had, and we want to kind of hit on those things and some positive things that's going on at Newport schools, which there's always a lot. But one of the things you and I discussed was the challenge of the wear and the tear that you've seen on your staff.
Certainly.
Kind of share that information with the general public, what you're seeing with your own staff.
Well, when you look at it in a regular year, there's stress on our staff, on our teachers, because they are tasked with educating children and getting them ready for their future. And this year it's a little different with COVID, because they're not only tasked with educating them in their classroom, but they're tasked with educating them virtually as well. And so you put those two together, and it's added stress on our staff. But I will say this, the teachers here in the Newport School District smile, and they pick it up, and they do what they have to because they love the kids.
It's always been that way, and I think what a great group of educators that we have here from the very top. When you talk about the Newport Special School District, and you talk about the school board, which we're meeting in the boardroom, and then you talk about the leadership at the top from the superintendent on down. When you get good quality people in place, you can get good quality education, regardless of the curveballs that we've been thrown. And we've been thrown a heck of a curveball, as the whole world has been thrown a curveball, the United States of America.
Yes, sir. It's really added a lot of stress across the nation, I'm sure around the world. We look at the fact that, you've got 20%, 10% of your kids that are virtual, that are streaming into your classroom, that you have to prepare for. Then you're preparing for the other 20 to 30 kids that are in your classroom. So it's not only put a lot of stress on school systems and communities, but look at the stress it's put on parents too. And we realize that our parents we're asking a lot of them, and they're asking a lot of us. And we want to make sure that we are meeting the needs of these young people, because for us, it's all about the kids. And they're the ones that are going to benefit from what we're doing, or they're the ones that are going to suffer from what we're not.
What do you do, Mr. Bunch, when you have, when certain things arise, not problems as such, but things that are different that we've never seen before from a policy standpoint? Sometimes you just got to just bow your back and say, here's what we got to do, because we've never seen this before.
True. We've had to make a lot of changes. The state's been a great help in helping us with our policies and making sure that we have waivers in place for things. One of the best things that we found out this week was that the president actually extended feeding our children, because right now we can feed all of our children free, and it was set to end December the 30th. Okay. But now it's been extended through the end of June.
Okay,
and
awesome.
So that's a great thing for our kids. But you have to be adaptive. You have to be able to make those changes, and really, we've put plans out, and we've had to adjust those plans. You have to be able to look at what's taking place and adjust for what's best for your kids.
Well, I'm in the public a lot. I hear so many good things that are going on over at this high school and in the elementary school, and it's a great place to go to school. It's a great place to get an education, even in a time when it's not the best time to get an education.
Certainly.
But let me tell you what we are doing. We are doing the things that we need to do to educate our children.
Yes, sir, we are. And again, I go back to my staff. I go back to the great people that I get to work with, the dedication, the commitment that they have. And that goes all the way through to our parents as well, getting their kids here and making sure their kids are doing what they're supposed to. It takes a team effort on everything that we do. And when you're talking about great things and good things that are happening, when you look at what's taking place on this campus, the high school campus, kids are wearing their masks, they're following direction, they're doing what they're supposed to, and that has helped us retain or contain the actual COVID spread itself. And then you look at our elementary. They're doing everything over there. We're feeding them in the classroom every day. Right. They're having, each wing is separated from the others. We're having the library in the classroom, art in the classroom, music in the classroom. So it's really transformed how we're doing education. But we're doing it because it's what's best for the kids. And even one thing that Ms. Thaxton, who is the principal over at the elementary, has done is they have planned a drive-through trunk or treat for the kids.
Oh, really awesome. Yeah.
They do not want that to be taken away from our kids.
There you go.
And, again, it's trying to make sure that we give them some normalcy in their life.
Yeah, I've always said things like this: you monitor and adjust. You have to monitor and adjust. But I appreciate the hard work that you do. I know you put in a lot of hours, traveling around the state, going to meetings and doing things to try to keep up. And a lot of athletics going on. I want to talk just briefly about athletics. And I mean, we've had a real good fall. We've had a pretty good fall athletic-wise. Talk a little bit about that.
We have. I mean, you're looking at the Hounds are 7-0 in senior high. Junior high struggling a little bit this year, but we've seen progress from where they started to where they are today. So, it's always tough to come in after you've been 27-0 for the last 3 years. But that's a great attribute to our athletic programs. Volleyball is still going on where we start district, and then we head into basketball season.
Right.
Basketball season is going to look a lot different this year for our Hounds. One of the things that we did, we actually had a meeting yesterday in Searcy with all the superintendents and athletic directors trying to figure out how our conference was going to do things. We talked about capacity and coming in and everything that we're looking for that we're going to be able to do. And one of the things that we came to consensus on is unfortunately, or fortunately really, we're going to be able to offer tickets just to the parents of the players, because our capacity is so small. We can get 133 people on our home side and 154 on our visitor side, and so we're prepared for that, and we want to make sure that those kids' parents get to go in and watch their children play. And so that's the way we're going to have to do basketball this season. But we're going to have a great basketball season.
Yes, there's no doubt about that. There's no doubt about it. And they can watch it. They can watch it right here on Facebook Live.
Yes, they can. And football season for the high school is going to extend quite a ways, I think.
I hope you're right, my friend.
I do too.
I hope you're right. Well, it's been a great fall, and it's been a great fall to be in school. And again, I appreciate what Brett Bunch does. I appreciate what your staff does, the school board here. In the community, we know we're headed in the right direction, and it's just been a tough old time to do it in with COVID, but man, you guys have been wonderful.
Well, and we also want to extend our thanks to you guys for live streaming. I mean, that made this year even better for our fans because we couldn't get them all in the stadium, but you guys came in and you're live streaming the games. Y'all do such an outstanding job of that, and it's exciting to listen to y'all when y'all are broadcasting those games, and like you said, it'll just carry over into basketball, and we're going to give our community some of the things that they're wanting, even though there are a lot of restrictions.
He's Mr. Brett Bunch. He is the head of the Newport Greyhounds, and we appreciate him taking time to join us on the First Community Bank Report each and every month, or most of the months. We do something every month to get to visit with you several times, and I thank you, sir.
Thank you.
Welcome everybody to the White River Health System Report in Batesville and also in Newport at WRMC Medical Complex. And we have Dr. Amanda Smith joining us. We have Tyler Sandlin, who's an APRN. Welcome both of y'all to the program.
Thank you so much.
We got to ask, we got to find out a little.
Thanks for having us.
First, and then I'll start with you, Amanda. Tell us a little bit about you. Tell us a little bit about your training. Tell us a little bit about your family. Tell us a little bit about your education, just to tell the folks who don't know you who you are and how you got to where you are.
Yes, sir. Well, I'm originally from the Batesville area. I graduated from Southside in 2008. After that, I did my undergraduate training at University of Arkansas in Fayetteville and went to UAMS for my medical training, for my medical degree. And after that, I went to Shreveport LSU branch for my pediatric residency. After that, me and my husband moved back here with our daughter. He was a Southside graduate in 2008 as well. And we've just really enjoyed being back home and being back on our old stomping grounds, seeing everybody that we went to school with.
I bet it's pretty exciting. And Tyler, I asked you the same thing. Tell us a little bit about you. Tell us a little bit about where you grew up, and tell you how you got into the field that you're in. Just tell us something about you, my friend.
Absolutely. So I'm also a Southside graduate. I'm a class of 2006 graduate. My wife is also a Southside graduate. She was 2006 as well. So this is in Dr. Smith's words, this is our stomping ground as well. I graduated, went into the U of A system. I also went to University of Arkansas Medical Sciences for my training. I worked at Arkansas Children's Hospital for around 8.5 years, in different capacities, mainly in the cardiovascular intensive care unit there. Have been home for around 3 years now. 3 years actually last month. And my wife actually teaches here at in the Batesville district. She's a kindergarten teacher here. So it's nice to be home. We've got lots of family around, and so it's kind of funny how we both ended up back here, and we went to school together. So it's cool. We enjoy it.
I'll just say go Southerners is all I say. We'll get into the nuts and bolts about what you do. Tell us a little bit about the Children's Clinic, and tell us, who are the providers? What is the Children's Clinic?
Here at the Children's Clinic, we have, so we function as an entity, a specialty clinic under the White River branch. We're one of the only pediatric facilities around in several counties. There are 4 of us providers, Dr. Smith and I, Dr. Chene and Dr. Moody. Dr. Moody, we just love her. She's our medical director for the clinic, and she's actually been practicing in our area. And she's been devoted to her community for over 20 years, and she's actually a Pioneer graduate. And so she's so wonderful to us. Dr. Chinayan also, he's a cool guy. He's had lots and lots of experience, and not only in outpatient setting, but actually he has a lot of, from a hospital perspective, he has a lot of inpatient pediatric experience, actually even practicing all the way to the UK. He's actually practiced there as well. So we've got a pretty cool team. We're proud of us. We're like a big family, so we enjoy it.
Well, when you get into today and we look back from, March and the last several months, and you talk about the pandemic and we want people to know that children need care. We're here. How important is it for people to continue bringing their children to the Children's Clinic? And in spite of the pandemic, we need child care. We need to see these children.
Have you got this one, or do you want me to?
I can start out. Yeah,
Go
so
for it.
absolutely, it's very important to maintain your wellnesses. We do so much more than just give vaccines at our wellnesses. We evaluate children to make sure that they're growing appropriately, that they're developing, meeting all of their speech, language, and fine motor and gross motor milestones. And if we're a little bit behind, then we can get kids plugged into all of the therapies that they need, because that is so important as you're growing and start school, to be up to date on all of your milestones. And of course, vaccines are very important right now. The AAP has said that we're down about 20% on our non-influenza vaccine rates this year, just from the COVID related issues. But we don't want to see a rise in those vaccine preventable illnesses while we're dealing with the COVID pandemic. So it's so important to keep up to date on all your child's other vaccines.
Tyler, I'll ask you this question. We talk about the pandemic, and we talk about COVID cases that are, kind of on the rise in your area and our area over here in Newport. So what do parents need to do to kind of keep their children safe?
It's one of those things. This year has been rather, a challenging year, not only for society, but also for medicine. It has been strenuous.
Sure.
We're balancing that act right now. We want to keep kids, obviously we want to keep furthering their education, but we also want to keep them safe. In the meantime, we want to keep our teachers safe and those around us, So right now, it's one of those things. In the past, we've been able to say, hey, we have the common cold. Your child may have the common cold, comfort measures, be sure and drink lots of liquids, kind of monitor those things. This year, it's almost like, we've taken a 180, and now it's like, especially for our patients or anyone who wishes to see us, if you're sick, cough, congestion, any of those symptoms, we want to see you. We want to see you. We actually have a drive-in clinic that we've been doing for around 6 months. now out in the parking lot. We're trying to separate our sick groups from our wellness groups. So if, and we want our parents to feel safe in being able to come in and know that we are going to, to separate those. We've got drive-in clinics. Simply all you have to do, roll into our parking lot, you call our main number. They'll tell you where the exact number to go to. One of our nurses triage you, and you get curbside service from us. We come out to the car, we see you. And that way also our infants, our newborn visits, all those, we can separate those wellnesses from those sick visits. And so we want our patients to know that we're trying to do that to keep them safe, but also, we want our patients to know, I say it often, and I borrow this term from Dr. Moody because she says it all the time, if they're concerned, we're concerned. So
Absolutely.
we're happy to see you for anything, and we will never, never not be here for you.
Well, at the children's clinic, and children, I mean, give me an age group. What do we treat from age what to what?
We do up to 18 years, from birth to 18 years. And we hate whenever we have to discharge patients, but unfortunately, we just have such a large volume of children under 18 that we can't keep seeing them after they turn 18.
I bet that would be difficult to do if you've treated them for that long and then they have to go on to the next step. Of course, at 18, you go on to the next step in life, and I guess you do as far as leaving the providers that you've had and the doctors that you've had. And I'll ask each one of you this question, and I'll start with you, Amanda. What makes the children's clinic so unique? What is unique about you guys?
So, one way we're unique, obviously, we specialize only in children, whereas, your family medicine doctors do children and adults, and they're great. We're also I feel like we're very family oriented, and we start to treat our patients as our own second children, if you will. We get to watch them grow from the time they're babies. We get to, see them whenever they start walking and talking and develop their little personalities. And it's just an awesome experience.
Tyler, tell me, if somebody wants the services of the children's clinic, how do we contact y'all? How do we make an appointment? What's the order of business? And kind of tell us exactly where you're located in Batesville.
Sure. So we're here actually in front of the main hospital, here on Harrison Street. We're actually across, if you're on Harrison, our building is directly across from the new Casey's gas station. If we're happy. We want to be seeing all of our patients. If anyone wants to come see us, we're here. 262-2200 is the phone number they call to get to us. And we will be happy to arrange a service if you need that. And also, I would like to, if I could, take the opportunity just to give a shout out also to all of our educators, if I can, because
Absolutely.
This is a difficult time, and they have been dealt a very difficult situation. And there are a lot of guidelines that are just hard to meet. We can encourage that social distancing and the masking and such, to try to keep our numbers within reason and try to help one another. And, because right now during this pandemic, it's all about loving others other than yourself. And that's what this is all about. And so we want to reach out to our educators and let them know that we're supporting them, and we appreciate them because they have a very, very difficult job right now.
Well, it's been difficult for a lot of folks in the pandemic, and it's been a change, and the world has changed on how we do everything, including how we treat patients and how we treat children. And no doubt you guys are doing a marvelous job at the White River Health System. And Dr. Amanda Smith, we appreciate you joining us. And Tyler Sandlin, thank you so much. And we wish everybody the best moving forward as we're going to get past this pandemic and we're going to get to where we need to be. Thanks, guys.
Absolutely. Thank you.